Hello everyone, my name is Nicole Akpunku and I am here to tell you why you should consider doing a residency. A little bit about myself. I am from the class of 2018, went to Illinois College of Optometry, the first and the best. And I did a residency in Atlanta, Georgia, or technically south of Atlanta, at Clayton Eye Center, where I specialize in ocular disease and primary care. And now I am currently employed at Southside Medical Center, which is more so of a community-based clinic where it serves the underserved. And I've been practicing here for maybe about 2 months. So anyway, let's jump into the video and talk about why I decided to do a residency. So for one, the reason why I wanted or decided to do a residency was because I wanted to literally perfect my craft. And I know this may sound cliche. A lot of people say it when you're asking people, why did you do a residency? But it's literally the truth. My long-term goal is to own my own practice. And so I figured if I'm going to be owning my own practice, you know, how do I increase my coinage? How do I keep all my patients in-house without having to refer for every little thing? And so the only way that I knew how to do that was to, you know, do a residency where my learning curve is exponentially increased. And so that's kind of, you know, how I decided to do that, because I was like, you know, when we're in school, there's only so much that we're taught. When we're on rotations, there's only so much that our brain can, you know, hold, especially with us studying for boards and things like that. It was just really challenging to, you know, keep everything together and still be the best while we were in school. So I was just like, you know, it's a pay cut, but it's going to help me in the long run to, again, be the best that I can be. So that's the first reason. The second reason I decided to do residency was basically to increase my clinical confidence. I felt like I was pretty confident in school. I'm not going to be honest. I feel like during my last year, especially maybe the third rotation, I started feeling fairly confident with my clinical skills. However, you know, you have to get to the point where you have to humble yourself and realize that there's still more that you can learn and that you don't know everything, and there's still a lot that can be taught. And that's where I got to the point where it's just like, you know, I feel comfortable. I feel like I'm good. I don't know if I'm doing. And then, you know, some of my rotations, I would see certain cases. I'm like, I don't know everything like I thought I did. Or, you know, I thought I'd seen that before. I never saw it because I'm now seeing it the way that this provider showed me. So that was definitely a huge eye-opener. And that was definitely one of the reasons why I decided to do residency as well. The last one is just literally more opportunities. People say all the time, it's another reason, another common reason, you know, if you have a residency versus someone who doesn't, not that, you know, the other person who doesn't have a residency isn't qualified or isn't a good clinician, but someone who does have a residency looks a little bit more well-rounded in totality. So that was kind of my, you know, gist of wanting to do one. For example, I probably wouldn't have got the position that I'm in right now if I hadn't done a residency, because, you know, that's one of the things that they talked about when I had the interview. They just talked, you know, that was the opening conversation. Tell me about your residency. Tell me why you decided to do a residency. Tell me what kind of things you saw. And so me having that experience allowed a conversation starter, which to them made me look more appealing. So that's just my 3 reasons why I decided to do residency. Not to say that, again, if you don't do residency, you are doing the wrong thing. But however, I will say for me, it was definitely the best decision that I made. I feel more confident in my skills on a day-to-day basis. And I want all of us to flourish. I want all of us to feel confident in all the things that we're doing on a day-to-day basis as well. So that is why you should do residency. Have a good day.